And that's where Japan's national roadmap comes in. Japan is currently working on a roadmap to cut COPD mortality from 13.7 down to 10.0 per 100,000 people by 2032. We call this project called More by 2032. It stands for COPD mortality reduction by 2032 project. This is operated by Japanese Respiratory Society, JRS. And it's also called Komorebi project. It's in Japanese word. Komorebi is a beautiful Japanese word. It means sunlight filtering through the leaves of trees. Can you imagine that? So it represents our mission to bring the light of early detection to that 90% of patients who are currently hidden in the shadows. The roadmap has two main steps. Step one is early detection. This is about mass screening and public awareness and strongly recommending that at-risk individuals see a doctor. And step two is improved diagnosis and intervention. So once in the clinic, we focus on the objective testing, smoking cessation, and drug or non-drug therapies to maintain their general health. Okay. In our roadmap, early detection is the essential first step. And we have found lung age via spirometry to be an effective tool for this. It serves as a practical door opener to reach smokers and spark their interest in cessation. So to motivate patients, we have to speak patients' language. Most smokers will just tune out if you say FEV1 per FVC is under 70%. Most of them don't understand about this. But when you say your lung age 65, they will listen it. And interestingly, we've observed a psychological effect too. Patients often try much harder during the spirometry test because sometimes they want to believe their language and try to make it younger. This extra effort actually results in more accurate and reliable spirometry data. We also know that telling patients their language helps improve smoking cessation rates too. And in Japan, we use a formula, this one, designed especially for the Japanese people and integrated into the daily checkups. It's actually a powerful way to start a conversation with patients. Okay, now let's look at how we get people to actually step through the clinic doors. In some parts of Japan, local governments are using nudges. It's a simple but effective tool from behavioral economics to make that happen. Let me explain about that. It's in a traditional approach to screening invitation. We use, usually we just say, please book an appointment if you are concerned, but people ignore it. But the nudge approach uses a screening placard like this. where patients fill in exactly when and where they will go. In Kazikawa City, Tokyo, this simple change boosted follow-up rates by 300% for the breast cancer checkups. So I believe this is the key to getting COPD patients into the clinic too. And for early detection to truly work, we need a solid infrastructure where spirometry is available. Let's look at the hub-and-spoke model from Gifu Prefecture in Japan, which completely transformed the landscape of primary care. The challenge in Gifu was that not enough clinics could perform spirometry. Also, that disease COPD was not widely recognized by the general public. So they started the Spiro Caravan project, sharing the spirometers with 73 primary care facilities. And they screened 593 patients who were visiting for non-respiratory reasons. And the result was that 32% were suspected of having COPD. And importantly, 83% of them were in the early or mild to moderate stages of COPD. So strategic takeaway for this case is opportunistic screening in primary care settings is highly effective. And it's a scalable model for uncovering hidden early stage COPD patients. So equipping primary care physicians with shared diagnostic tools such as spirometers transforms the standard clinic visits into the front line of respiratory discovery. And now let's talk about how we actually confirm those cases in step 2. So once we found them, we need a precision diagnosis. And according to JRS guidelines, the essential requirement is post-bronchodilator FEV1 per FVC ratio under 70%. And if there's a smoking history or symptoms like a cough, sputum, objective testing is necessary. So it means X-rays and CT scans to see the lung damage and blood tests to check for inflammation. So airflow obstruction is the core, but as we all know, the lungs don't live in a vacuum. We have to look at the whole patient. So in Japan, we see COPD as part of a web of interconnected risks. When we evaluate a patient, we are also looking for things like heart failure, GARD, diabetes, and osteoporosis. So managing all of these together is the only way to really lower mortality and help people feel better. Okay, and everything I have mentioned so far is part of the national roadmap. But now I want to introduce another tool that's separate but very important. It is the forced oscillation technique, or it's called FOT. Yeah, in Japan, FOT is often used in daily practice to get deeper insights without patient's maximum effort. So if you ever tried a spirometry test, you know how hard the forced exhalation is it's very hard for patient to give the forced exhalation during spirometry test. So so this is where FOT, or it's called oscillometry, comes in. So unlike spirometry, it only requires normal breathing. Only normal breathing is okay with FOT test. So, and it takes just 20 seconds and it's much easier for elderly patients or even children. And while spirometry rate measures the flow and volume, such as FVC, FEV1, peak flow, and MEF, oscillometry measures the total respiratory resistance, such as R5, R20. It means resistance at 5 Hertz and at 20 Hertz, or R5 minus R20, or X5. So this FOT identifies total respiratory resistance, and it gives another diagnostic parameters to make the diagnosis more accurate. And another clinical advantage is the 3D graph visualization by our FOT device called MOST graph. So mapping resistance through the entire breathing cycle reveals the unique visual patterns of COPD and making it easy to identify at a glance. For example, this is a typical waveform patterns of the normal patients and COPD patients and asthma patients. It's a typical waveform pattern. And it also helps patients intuitively understand their lung condition. So when they can see this graph, they stay engaged and much more likely to stick to their treatment plans over the long term. So by combining objective tests like oscillometry with our strategic national roadmap, we can make early diagnosis and treatment far more effective. I truly believe that this framework can serve as a powerful model for respiratory diagnostics right here in Malaysia. Okay, to wrap up, early detection is more than just good medicine, but it's a vital national investment in our future. So Japan's Komor by 2032 roadmap provides a proven blueprint to help us that hidden 90% of the COPD patients in Malaysia. So our company CHEST and our local partner here, Translab, are here to provide not just the equipment, not just provide us spirometers, but full system solutions that you may need. So let's turn the silent burden of COPD patients into a legacy of healthy breathing in Malaysia. Thank you so much for your attention.